Greetings and thanks for tuning in today. Today we are going to talk about how to use a tennis ball and a lacrosse ball to release trigger points. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy. I'm a certified athletic trainer, certified personal trainer, and a certified precision neuromuscular therapist, which means I do medical massage. I also am a fitness nutrition specialist and a corrective exercise specialist, and I hold a credential in exercise as medicine. The reason I want to show you this today is because I specialize in treating people with aches and pains, stress and strains for longer than 3 months, and I specifically specialize in helping people reduce their headaches and migraines so they can experience headache-free days. What I tend to find, whether I am working with somebody with fitness, whether I'm working with somebody with medical massage, or whether I'm working with somebody virtually, like doing virtual coaching and helping them relieve their aches and pains and teaching them how to fix themselves, what I tend to find is that we hold a lot of tension, and my clients hold a lot of tension, especially in their neck and in their upper shoulder areas, as well as in their back. So what I want to show you is in between appointments with a specialist that's local to you, or if you're seeing me, whether you're seeing medical massage, whether you're working with acupuncture, chiropractor, or maybe you're still even in physical therapy in that traditional model. Whatever that means for you, you can, in between your sessions, do some trigger point releases to help the hands-on work that you're receiving from the specialist that you have chosen. Or maybe you're doing virtual coaching with me, and I am telling you that if you work your muscles and release the trigger points and the tension and the tightness in your muscles in between those exercise sessions, you will have a much better and effective workout, and you will also recover better. So what do I mean by that? Well, when our muscles are tight, they're in a shortened position. They're really balled up. If you have a trigger point in them, they physically have something impeding them and restricting them from fully contracting, but also from fully elongating and stretching out. This makes your muscle less efficient. So before you work out, or in between sessions of your hands-on therapy, whether it's acupuncture, medical massage, or traditional physical therapy, in between those sessions and before you exercise, you want to release those trigger points and those areas of tension so that your muscles can contract and relax more efficiently. Now, how do you do that? First of all, you find those spots. Now, you do have to be careful. I'm going to caution you. Sometimes people will feel this muscle and it kind of flips. That is the levator scapulae muscle. It runs from the first, second, and third, and fourth cervical vertebrae all the way to the superior angle of your scapula or your shoulder blade. That little flip that you feel is not a muscle knot. It is a twist in the muscle that is naturally there. It's supposed to be there. So don't go digging in on that, or you're going to make that area hurt, or you're going to give yourself a headache because you're going to inflame that muscle, and that muscle is going to be irritated and it is going to scream at you. And we're trying to resolve that. So if you find a muscle that kind of flips on itself, do not dig on that. You want to actually stay away from that or be gentle around that area to make sure that you are not trying to work on an area that's supposed to be like that. Now, having said that, what you can do is if you use a wall, most walls are textured. It is less likely for the ball to drop. But if you don't have a wall that, is filled with, you have picture frames and things like that, and you don't really have a clear space, then the back of a door that nobody's going to open on you will work just fine. So what you want to do is, if you're using the wall, you can either take the lacrosse ball or the tennis ball. The reason I show both is because if you are not super tender, but you're just doing this as a preventative maintenance and relieving some tension, you can use the lacrosse ball because it's firmer. If you are really tender and sore and you have a lot of chronic issues in through that muscle area, whether it's up and through your neck or somewhere else on your body, I recommend the tennis ball because it is a little bit more forgiving. You can actually squeeze that. You cannot squeeze the lacrosse ball. So I'm going to show you with the tennis ball. You may choose the lacrosse ball if your symptoms are just or if you're in a situation where you're just relieving some tension. But let's say you have some trigger points and some muscle restrictions and you're pretty tender. What you're going to do is you're just going to lean on that tennis ball and start to go in a circular or a back and forth motion. So this would be a side to side, this would be an up and down, and you are just going to move like that. You can also kind of move around and in a circular motion. Whatever you want to do, there's really no wrong way to do that other than if you start rolling across bone. Do not roll on bone. That is painful and we don't want that. We're trying to relieve symptoms, not cause symptoms. Now, if you find a spot that reproduces your symptoms, for example, if you suffer with headaches and you find a soft tissue restriction or a trigger point or a tender area and that reproduces your headache symptom, like up into your head or across into the eyebrow or even into the forehead, hang on there. Do not exceed a level of 4 on a 0 to 10 scale, with 0 being no symptoms and 10 being emergency room. Or I actually prefer to use a scale where it's a 0 to 140, which is kind of noticeable. Do not exceed that kind of noticeable range. So you can hang out on there and then hold that for about 30 seconds. You can actually hold it up to 2 minutes, but at least 30 seconds. And the reason is it takes your brain 30 seconds to tell the muscle to turn off. So we want to give the brain to the muscle connection an opportunity to fully relax. And after the 30 seconds, then you can move to a different spot. Or if you find that your symptoms are relieving but not completely gone, go ahead and hold for that 2 minutes. Now let's say you don't have a wall that you can do this. You can absolutely do it on a door, but understand that it's a little slipperier, so it's a little harder. What I recommend is that you put the tennis ball or the lacrosse ball into a long sock. Then you can hold on to the sock and it won't keep like dropping on the floor, and then that's aggravating if you have to keep picking it up. So rule of thumb, just to recap, the lacrosse ball is a lot harder. If you want to use the lacrosse ball, you should really be doing your trigger point releases or your soft tissue restriction releases if you are just experiencing muscle tension. If you are experiencing chronic symptoms, pain, or very, very tender in those areas, when you roll the tennis ball across them, I'm saying that it's more than a 40 out of 100 on that scale I described earlier. You want to stick with the tennis ball. So test it with the tennis ball, see how tender you are. If it's just tension, you can move up to the lacrosse ball. If it's very tender, more than a 40, then you want to stick with the tennis ball. And when you apply pressure, you want to keep that pressure at no more than the 40 out of 100. It's kind of noticeable. Then you hold it there for a minimum of 30 seconds to allow the brain an opportunity to tell the muscle through its nerve connection, or what we call neuromuscular connectivity. When that 30 seconds is up, then you can either relax and move to a different area, or if you're still noticing symptoms but they're subsiding, then hang out there a little bit longer, up to 2 minutes. And that is going to help you to release those trigger points and those soft tissue restrictions so that when you go to do weightlifting or when you go to perform your stretches, then your muscle will be able to function more optimally. I hope that you found this as beneficial. If you did, please go ahead and comment in the feed below. I really want to hear your comments. If you have suggestions for other videos that you would like, please go ahead and make those requests as well. Thanks a lot and have a blessed day.